Hi, can you hear me? Oh,
There we are.
okay. My name is Robin Cash, and I am the proud mother of the founder, Rachel Cash. And so I was before the actual just the three of us online right now. So I really wanted to tell you, welcome to the city. I know you've most recently have moved here and we met your friend at one of the events in Florida that we were, yeah. So it was really lovely sitting and having lunch with her, and she was really excited to um, tell us about you. So that was really nice.
Yes, what the world is small, and these connections are so important. And she is a gifted physician and community public health advocate in her own right, Dr. Colette Brown Graham. So I'm glad that this connection happened.
Yeah, it's really nice. She support because I'm dual membership in the links. Because I'm in Florida half of the year, she supports the West Palm Beach chapter of the Links every year with this health fair that we have, and she's fabulous. So we do appreciate her.
Yep.
So I guess we'll get started with the Elroi Expert Exchange, and with us today is Dr. Claudia Richardson, who's MD and a Master's of Public Health. She is leading the Public Health Initiative, and we'd like to start this conversation by opening the floor to Dr. Richardson, who is currently the medical director for the city of Detroit and is a nationally respected public health leader with over 2 decades of experiences shaping infectious diseases responses, emergency preparedness, and equitable systems of care. And so we'd like to just open the floor to you just briefly if you'd like to add anything more to set the tone for our discussion today.
No, I'm just honored to be here. I've been moving around a little bit this summer, learning a lot. Just recently returned from the National Medical Association annual meeting, national meeting, and boy, were the topics hot. And I learned so much in that space and was surrounded by so many brilliant minds. So I'm anxious and excited about this conversation today.
Wonderful. So, um, want to kick off the discussion with talking about surveillance systems of outcomes at the edge of public health, and I know you've served in leadership roles in community health organizations in Virginia, North Carolina, and now in Michigan. And the question would be, what core values have remained constant across these settings?
Well, one of the most important things is that we uh, do work with communities, not at communities, and that we um, bring them in from the very beginning to try to help solve problems, ensuring that we keep access to care and access to quality care at the core, whether not influenced by what level of care. For example, we want quality care when we're, as a doctor, MD, when I'm looking at a patient, but we also want to look at care as being quality care when we're looking at it at a population level as well. So making sure that we keep those things before us of that our patient, that our constituents, for me in this seat, have access to quality person-centered care are core values that I've had with every part of my medical practice, from solo practitioner in rural northeastern North Carolina to being a medical director of a city, an urban city.
Very good. And that's excellent to hear because we know some of the things that we do in some of the organizations that I am is look at the health and inequities and to hear a community leader, a medical leader in the community say it is very important to recognize the and that the core value is consistent and care for all of the folks that they're serving. That's a wonderful thing, and I appreciate that. What makes you think the system, looking back, give me an example of something that you feel is making that makes you feel like it's working and that we're moving the needle for health inequities?
I'd have to say right now, um, I've done lots of work. Like I said, even in private practice, I always wanted to, saw opportunities to work with the health department in spaces. Because I know, if we can just connect those dots and get medical providers plugged into the public health system, the work that the public health system does is always amplified because the providers are right there in the community, or at least we hope
Right.
that they're right there in the community. But I would have to say, one thing right now that the city of Detroit and the Detroit Health Department are working on is this Rides to Care program. And I'm so excited about that effort because it's a program where women who are pregnant or have given birth recently have access to ride share uh, delivery of method of transportation just by making a phone call.
Oh, wow.
And we've actually served over or provided over 10,000 visits in less than a year.
Wow.
And while we won't know how this will affect outcome, the engagement itself is exciting because transportation, as we all know, when we look at social determinants of health, or transportation has always been a problem, whether it's in a rural location or in urban areas. It's
Right.
hard for people, and especially working women, young working women, to get to doctor's appointments, get back to work in a timely fashion. And oftentimes they have to make tough choices, which might include missing a doctor's visit while they're pregnant. And so to be able to have this level of engagement is exciting. And I am sure that, and very hopeful and pretty sure that we're going to see some results, positive results, because of this engagement.
Well, that sounds excellent. And it's interesting. I know that in Naseba, we need to lift some of these up as we on our websites and our engagement in our social media because I had not heard of it. But of course, I'm far beyond the childbearing age, but certainly some of the folks that are in the community that we serve would be may be very interested in that.
Yeah, the name of the program, just so you know, is Rides to Care.
And I've made a note of that. Thank you.
And another addition to that is that, not only do we care for moms, but for their children up to a year after delivery,
Wow.
they can get rides to their pediatricians.
So see, that's awesome and very good information to know and very good information. I mean, that's a I believe too that you're going to see some significant, statistically significant positive results once you're finished unpacking that data. Um, so for cross-jurisdictional collaborations and system innovation, what are some of the real world decisions your team has made using technology in the community?
Um, well, as far as the technology, I mean, we want to, good public health is data is informed by data. And two initiatives I'll bring up right away that clearly utilize data are related to our naloxone efforts and placement of certain of many of our interventions, including um, harm reduction stations. We've actually placed stations throughout the city of Detroit. We have a few out now and a couple of models of those stations, if you will. And we will continue to add, and this has been extremely exciting. And basically, these harm reduction stations have naloxone, have testing for xylazine, which is another harmful medication. And anyone can just walk up to these vending machines technically, and take Narcan, life-saving medication that can help our Detroit residents. We recommend that everyone keep Narcan. I keep it in my car. We recommend that everybody have. You just never know where you might be. You might be at a concert. You might be in a store or
Right.
something. But that the location of those harm reduction stations were informed by data from our state, one of our state systems that collects it on the locations of frequent overdoses. So where,
Um,
EMS has to go to provide Narcan, um, it gets logged and we have access to that. So our epidemiology team sort of figures out those locations based on that database. And those are the areas that we've chosen to place those harm reduction stations.
and so while they're strategically located by the incidences or the number of the high incident rate, a layperson like myself that's outside that region could go over and um, secure one of those Narcans as well. And where will we find
Absolutely.
the locations?
Um, what, well, I have to, I can't spit those zip codes off right off the
Yeah,
top of my
that's
head,
okay.
but I can certainly send those to you.
Wonderful.
But one of the one area that we targeted in was in the beautiful new Jason Hargrove transportation station, where
Oh,
many of the
wow.
buses come together. It's a beautiful facility out near 8 Mile, and I'm sure you know what
Yes.
8 Mile is.
It
And
was it's the old state farm or state fairgrounds.
it
Yes,
is.
it is
It is.
beautiful.
It is absolutely beautiful. So we were excited to do our sort of public launch in that space
Wow.
to introduce the community to those harm reduction stations. So that's just one example. Another example, of course, is with our lead um, testing work. We certainly, look at the areas that have highest number of reported high lead levels and try to target those areas as well.
Wonderful. Those are two excellent examples. I'm learning so much and I appreciate you sharing. I appreciate you reaching in and being and sharing this information with us because this helps the community. And the more of us that know, we can also share that information. And so one person sharing at a time can make all the difference in the world. Um, so you've spoken about communicable diseases and having no borders. And how is your cross-border collaboration with Windsor, Ontario, operationalized? And what outcomes have you already seen? What has already been supported?
Well, first, when I think about that, first of all, you have to acknowledge the recent challenges that they've had with measles. When you see the world talking about measles in Canada, a lot of that has been literally across the border in Windsor, where they've
Right.
had the significant outbreaks. And I'll say, what have we done, or how do we engage with our partners across the border? First, an obvious and seemingly easy eh, method, quite frankly, is by developing good relationships. I have a great relationship with Dr. Lush, who is my peer colleague over in Windsor. We call each other frequently. More frequently when something active is going on, primarily in the areas of communicable disease or environmental challenges,
Right.
because we know the wind blows, in certain ways. We, have the challenges around the wildfires from
Right.
Canada affecting the air in Detroit.
Correct.
And also, we have a lot of employees that travel to and from
Right.
Windsor and Detroit on a daily basis,
Yes, ma'am.
And so when there's something that's coming to light, if you will, that may affect that, we reach out to each other very quickly. And likewise, we've ensured that our uh, uh, team members are familiar with those with the same roles in each health department. So our
Mm.
epidemiologists have met their epidemiologists. And so taking the time to cultivate those relationships at times of peace, if you will, in communicable disease is worth it. And so we've done that. We've visited each other and just learned more about how they do things and how we do things. That relationship building has been critical. Secondly, we have a few joint initiatives with them. One around just the surveillance with the construction of the Gordie Howe Bridge. That included some of our Canadian partners, and also this wastewater that I think was on LinkedIn recently was is an effort that wastewater monitoring that involves several partners in the city of Detroit, including the Detroit Health Department. I'll say Detroit and Wayne County, including the Detroit Health Department.
Wonderful. Um, and from Virginia to Detroit, you've worked across agencies and states and now national borders, as you're describing. So, um, and you've described how that collaboration and those relationship building and maintaining healthy relationships and an open line of communication um, can enhance the success of our health outcomes for these international borders. When you think of equity, ethics, and their impacts, how can community health systems continue um, to prioritize over people? How do you ensure the dignity, privacy, and the trust of the community that you're serving?
Well, I just go back to what I stated earlier in that we have to engage our communities and our community-based organizations. Those folks that are right there in the community and know their communities well. We partner with them in a big way. And also we want to consider those, pastors, other trusted leaders to we want to engage them into the work of the health department as well. We realize all of that uh, helps us show up as a trusted partner in the health of the communities of the residents of Detroit. Um, and again, as I said, we want to do work with people. And so approaching public health in that very collaborative way does help. Realizing that, we all want the same thing. People want to live, lives where they thrive. That's part of our mission statement at the Detroit Health Department. We want to help Detroiters thrive. We want to make sure that we're showing up as a partner. We also want to realize that people have a good understanding of what how they can help their community, how they can help themselves and help their community given appropriate resources, or and education is a resource. So just really ensuring that we're doing work with people and not to people,
Right.
uh, with residents, not to residents, is how we do that work.
Yeah. So that is key. Thank you. And I know I got a signal that we're coming close to the end, so I want to jump to looking ahead. So, if Detroit, under your leadership, um, if its public health system could be a national model in 5 years, what does it look like in your vision? And what would be the differentiators and to make it more responsive and preventative?
Actually, that is a difficult question right now, because we are finding ourselves in a space where we, instead of focusing completely on taking things to the next level, we find ourselves right now trying to protect what we have already done, or what was quite normal, which was quite routine. We're having to shift our focus to, in a way, to protecting that. But let's be clear, public health, the work of public health, the work of the Detroit Health Department will go on. Public health has always figured it out in one way or another.
Right.
So we will continue to do that. Um, but as far as taking the model, the Detroit Health Department, the work we do, just reflecting back on what I've said, we feel very strongly about doing community informed work. So taking that model of working with community based organizations, working with communities, listening to them, and then, of course, being innovative, like rideshare for 10,000 rides in less than a year. Taking those bold steps to and thinking out of the box, but taking those bold, innovative steps to do work is what I think, a model of the work of the Detroit Health Department would look like, and how it could help us nationally.
Yeah, excellent. I hear you loud and clear, and I am 100% aligned, which I know most people will be. And when you speak to maintaining the things that have put in that were already that may be a challenge with the current climate, and so I understand that really well. So thank you for lifting that up because as we think about futuring, we always need to make certain we're preserving what's in place, especially if there are any efforts to attack the things that are serving our community. So I understand the messaging very clear, and I thank you for reminding us of that. And in that question, it was a part of the question. What lasting comments might you have for the Elroi folks who are looking at this space in terms of the managing that data, your own personal data, and having accessibility to your data from a holistic perspective so it can be in one package and help to um, so that you're able to manage your own health more effectively.
Well, as I said before, we have to recognize that individuals know their environments, and they need to be given tools to um, to help manage their health. And having access to their information so they can share it with the appropriate people, um, and also have access to education and resources in a efficient way will
Right,
only help us.
right. Very good. I know we have some listeners. If there are any questions that you'd like to ask Dr. Richardson, you can drop it in the chat. And if if she needs time to think about it, if we have a little time, she may be able to address them. Otherwise, we'll make certain that if she sees those, we can get some comments with regards to those at some later date. If I don't see any of those, I'd like to thank you, Dr. Richardson. This has been an outstanding discussion. I'd like to remind our viewers live and those that watch the recorded session that you can look for us at Elroi_AI, and that join us for the next expert Elroi exchange. And we're highlighting, and our goal is to highlight these very top level leaders at the forefront of the systems of innovation for health equity. We thank you.
Good day.